There's a lot of great surgeries out, a lot of new research, bunion splints that claim to reverse bunions. Which one of these studies are real? Which one of these surgeries are worth getting? Are they just a money grab? Are they a waste of money for you? We're starting now. Essentially, this right here is a bunion. When this bone buckles out like that, so you can see right there, that right there is a bunion. When you get a bone spur on top of the big joint where it can't bend up, that's called Hallux rigidus. So you can get arthritis in your big toe joint. So if you don't have any cartilage in this big toe joint right here and it can't bend, that's arthritis. But if the joint actually buckles out like this, that is called the bunion. If these toes right here bend like this, so if these curl like this, that's called a hammer toe. So the smaller toes are called the hammer toes, but technically the big toe could get a hammer toe as well if it bent right here. If this joint right here bends, that's not a bunion. That's called Hallux interphalangeus. That's common as well. A tailor's bunion is the fifth toe right here. So if the fifth toe buckles out like that, this is called a tailor's bunion right here. So you could also get arthritis, you could get a bursa on the fifth toe, but generally the big misconception is that a bunion is a big bone spur. That's something called Hallux rigidus. Essentially, the big toe, the fifth metatarsal, if there's misalignment, that's called a bunion. It's enlarged, the skin can get swollen. The Hallux rigidus is actually arthritis. So that could be osteoarthritis, and there's 4 grades. It goes from very little arthritis to like, hey, it can't bend at all, full strength osteoarthritis. The tailor's bunion is the fifth metatarsal. It's deviated. Now the trick is, most people that think they have a tailor's bunion, what really happens is their foot flattens out and rubs against the outside of their shoe, and they develop a bursa, it gets swollen, it gets irritated. So technically you don't need surgery to fix it if it's your whole foot turning out. It's said that 23% of adults between 18 and 65 get bunions, and over 65, it's even greater. It's almost 40% of people with bunions, but because you get more arthritis, the joint gets bigger, it's sometimes misdiagnosed. Women are actually way more, 9 to 1 times more common to get it. It's because women give birth, they have more flexible joints because of childbirth, they wear nicer, pointier shoes that can stretch the toes. The symptoms of bunions are pain, discomfort, rubbing in tight, narrow shoes. Your foot actually does get wider and stretches. The pain can radiate up the arch. You can get redness, swelling, inflammation. You lose motion. So once that toe is stuck in that position, arthritis is more likely to develop from the misalignment. Recent studies on bunions, genetic factors, the Journal of Foot and Ankle Surgery showed in 2019 that genetic factors definitely play a significant role. If your mom or dad had it, there's a good chance you're gonna have it. Number 2 is shoe selection. So the Journal of Orthopedic Research in 2020 showed that narrower, tighter shoes and less supportive shoes are associated with bunion formation. Now, it's not just them squeezing it together, but basically without any arch support, heel support, as your foot flattens, the tendons will tighten over time. And same thing too, if there's no room for your toes, they will get used to being in that position. To me, that's a very common explanation. I'll cut to the barefoot shoes, because here's study number 3 is barefoot shoes are great for some, horrible for others. That's the bottom line. The real key here is a biomechanical exam. If you are uneven throughout your back, throughout your hip, throughout your knees, barefoot shoes can help in some ways, but hurt you in other ways. This is where the videos I see online talking about barefoot shoes, and in the comments, I love you barefoot guys and gals, because if they work for you, I know you want to sing it from the mountaintop, but most older people with bunions and arthritis, the worst thing they can do is wear barefoot shoes because it's going to give them stress fractures, it's going to throw out their knees, their hips. Yes, barefoot shoes can strengthen your muscles, but you need pretty good alignment throughout your knees, hips, lower back, and feet in order to do that. About 75% of people I see in clinic, probably more, would gradually get hurt by barefoot shoes, and that's why they don't wear them. If barefoot shoes were so good and if barefoot walking was so good, why wouldn't everyone do it? It's essentially free to walk barefoot. It's easier. You don't have to put on anything in the day. I like to think about it like this. If you broke your ankle, would stronger muscles help? Yes. But the time to get your stronger muscles is after your bone heals and after your problem heals. The worst thing you could do is go to the gym and strength train when you have an injury. And a bunion and a tailor's bunion and most of these foot problems that I talk about are injuries. By trying to put too much weight on them, you will actually hurt yourself and make your problem worse. And thus, you put on even more weight, get stiffer. That's how I think about barefoot shoes. But yes, if you're already pretty healthy, but just stiff and you have great alignment, barefoot shoes will work great for you. That's where a biomechanical exam comes in, and that's how I interpret the studies for barefoot shoes. Can you reverse bunions? Take a look through my bunion comments. Sometimes people are like, hey, there's no way you can reverse it, but other comments, there are, I would bet hundreds of comments now where people are like, hey, my bunion actually reversed. And yes, I see it with my own patients. The problem is no one's gonna put out studies on these things because no one makes money by conservative treatments like not doing surgery. But you make a ton of money doing surgery. Like I'm talking 25 grand for a hospital every time there's a surgery. They're gonna pour a lot of money into implants, into studies. That's why all the studies are done. And that's kind of true with most medicine. The more studies there are, the more evidence tends to lean that way. The less money there is, the less evidence there is to lean that way. Am I wrong? Let me know in the comments. Now, new treatments and new studies. Number one, orthotics and insoles. There's a lot of great 3D maps now, a lot of great custom orthotic ordering devices. I link to my favorites below. I think they work really well. I have videos that go over them. I think that's a really good option. I'm gonna talk about that a little bit later in this video. Number two is the move towards minimally invasive procedures. So I'm personally a huge fan of minimally invasive procedures. I think easily recoverable procedures without implants. The studies are improving. They're more cost effective. They don't need to be done in a hospital. I think when combined with the proper shoes, the proper insoles and offloading, they can make a huge difference. I've gotten away from doing the huge heavy reconstructions because I just don't feel like they were the best thing for my patients. That's my personal experience. I know there's a lot of good doctors doing a lot of good work that don't agree with that. But again, that's my personal experience. I think we were made with a body that's designed to heal itself, and I think we should go with the flow rather than trying to impact as much metal into our bodies as possible, because our bodies are not created or designed, however what you want to think about it, to be loaded up with metal and have all our joints replaced. I don't think that's beneficial for the average person unless there's some type of severe debilitating trauma where it's 100% needed. Now, medications too. There's a lot of great medications. If you have inflammation, it will help with the pain, but anti-inflammatories, ibuprofen, Advil, that kind of stuff, it will not solve the underlying causes of the bunion. The new research as well, biomechanical exams, gait analysis, this is where the future lies in fixing and preventing bunions, in my opinion. Let's talk about surgery for bunions. Number one, you have a bunionectomy. This is also known as like a silver or shave or chilectomy. If you have a spur, if you have a protruding bump, for very mild bunions, it's possible to shave down that bunion. So you could take a burr or a rasp and you could smooth down the edge. If there's a spike or something, that does not correct the angle of the bunion. It just kind of shaves down the prominent area that might be rubbing in your shoe. And this is a big component of minimally invasive surgery. It's almost like you hold it straight with orthotics, with shoes, with proper foot gear, with stretching, with exercises, and you could help it along a little bit. You can do that in the office a lot of the times with the proper equipment. It doesn't require plates or screws that then might need to be removed or further surgery done on. The success rate is about 90%. The 10-year satisfaction rate, probably not as high, but it's gonna be true for all of these. So it's kind of in that 90% range, but really the choice is the key. If you have a severe bunion with osteoarthritis in the joint, then this will not help. This is more for mild, easy bunions. And the Orthopedic Foot and Ankle Society journal did show that studies are about 90% success rate. Number two is an osteotomy. So these are bone cuts that realign the bone throughout the big toe joint. So these are your chevron, your Austin, your Z-cuts. There's a lot of different procedures. There's so many of these, you know, there's at least like 10 that are pretty common. These are for moderate to severe bunions. These are your classic 2-screw bunions where you shift the bone, you put 2 screws in there, and it's a smaller incision. You can walk, it's stable due to the cut. This corrects the big toe joint and the intermetatarsal angle as well. With some of these procedures, you can rotate the head as well. Minimally invasive surgery addresses this as well and does this type of procedure. And sometimes you can skip the screws in a lot of cases. The idea is your joint falls into the natural alignment. The success rate, again, is pretty successful, 90% or more in the Journal of Foot and Ankle Surgery, when looking at past outcomes, and people said they would do it again. Number 3 is the Lapidus procedures, or the midfoot fusions. Now, these are the so-called 3D bunions, and probably if you're Googling bunion, looking for this video, you're gonna get Google ads for this kind of stuff. These are the bigger procedures, and the reason that makes sense is the medical device companies sell a lot of hardware to put in your foot. They're the most expensive ones. These can't be done in the office. They have to be done in the hospital. There's a lot of money associated with them, and they're big reconstructions. I'm not saying they're bad. There's a skew towards these because that's enough money to perform advertising by these companies. And as a result, some patients come in to clinic and they're convinced that, hey, I need this big 3D reconstruction. The ads say this is the way to go. Again, that kind of goes back to, if a lot of money is being made, there's going to be more advertisements. For something simply done in the office without having to go to the hospital or without using a lot of plates and screws, there's not any money for advertising. Something to think about. A lot of people love doing this procedure. I've known a lot of great surgeons that do a great job with this. If you have a severe deformity with a weak midfoot, this is a great idea. But otherwise, what you want to do is you want to start smaller and correct the foot. Again, this can be a great procedure. The Foot and Ankle International Journal actually showed that the success rate is between 80 to 95% in terms of pain relief, functional improvement. So you see, the results are not necessarily better. And when I take time and I talk to patients that come in, it seems like the bigger the reconstruction and the bigger the surgery, the more problems people have long term. But that's not fair to the 3D bunion manufacturers, because the people that need these are much worse shape at the beginning. So the answer is, these are actually amazing surgeries, but if you have a tiny little bunion, they're not an amazing surgery for you. I have a lot of people that have a very tiny bunion that doesn't even qualify as a bunion, and they come in looking for a huge reconstruction of their foot because an ad showed them that. You just gotta be careful to get a proper analysis, because a lot of doctors, a lot of clinics, financially, it makes sense to just get you in there and do these huge procedures. But that being said, I'm not bashing any of these devices. If you trust your doctor, these are amazing procedures, and I've done a ton of them myself. They work extremely well with the proper diagnosis and the proper patient selection. But you can see the study results are actually sometimes worse in some cases, because the patients that need them are in worse shape to start with. And number 4, minimally invasive procedures. You can do all of these procedures through minimally invasive terms. That just means smaller incisions, smaller cuts. And this is for mild to moderate bunions. If you have a really bad flat foot, then you want to do a bigger reconstruction rather than a smaller one. Success rate for minimally invasive procedures varies. Because the procedures vary, it just means you're trying to make smaller incisions. This lets you do it in the office, lets you do it with less anesthesia, less complications, because it's less of an effort put into the procedure in terms of plates, screws, hardwares. You're not doing a massive reconstruction. You're maybe shaving some spurs or realigning a small bone. This works really well for like hammer toes. It works really well for things like Taylor's bunions as well, shaving a little bit of a spur. Patients who are more high risk, diabetics, that kind of thing, that's where minimally invasive is a good idea. I tend to do more of those because more of the patients that I see are more high risk with health issues. And number 5, that's a fusion. So that's called an arthrodesis. So this could be a first metatarsal joint fusion. This is for severe bunions with severe osteoarthritis. Again, if you have a tiny little bunion, you don't want to fuse your joint. This is a more permanent procedure. If you don't want joint motion because it really hurts you, this will straighten it permanently. The success rate is actually pretty high on these because it's going to keep it straight, pretty much guaranteed, but you won't be able to bend the joint anymore. If you're just walking around smaller amounts or going on occasional trips, that's probably what you need. But if you're a bowler, if you work in labor and you have to bend over a lot and you need to bend your big toe joint, then you probably don't want to get a fusion, until you're retired at the very least. And a flat foot reconstruction. I have some great videos on is flat foot surgery worth it? Sometimes. If you have a deformity like your ankle or foot dislocated, it makes a lot of sense to get a flat foot reconstruction along with the bunion. But it's a huge procedure, a lot more recovery. You're talking like 6 to 12 months until you're using your foot properly again at full strength. And this is where a biomechanical exam is really important. If your ankle is buckling, if your knee's bending in, if you can barely stand, if your hips are out of whack, that's when more of a reconstruction makes sense.